Well, welcome this morning. Thank you very much for making this effort so early today. I'm going to introduce you to the features, the special features of this high-intensity frequency ultrasound, which basically is a system to heat up different levels or different layers of the skin. And in this system, as in many other HIFUs, what we're really doing is focusing everything at a certain depth, like 1 millimeter, 2 millimeters, 3, 4, 5, etc. But Liftera is not exactly this. It's not really our HIFU. So it shouldn't be called HIFU, really, because HIFU is a technology that heats up depths at 1, 2, 3 centimeters. So this is strictly micro-focused ultrasound, not really high-intensity focused ultrasound. We can also say that this is a second generation because it doesn't work the same way as other systems do. These are the different examples, and you can see how you can heat up deep into the fat layers, and you can see some contraction, right? So let me first go to tell you the difference between HIFU and micro-focused ultrasound. So HIFU is something using high energies, 47, 50, 50-something, whereas micro-focused is using slow or little amounts of energy in the range of 0.4, 1, 1.5. Secondly, HIFU reaches depths of 1, 2, 3 centimeters. Micro-focused doesn't reach that depth at all. It's about millimeters. That's why it's called micro-focused ultrasound. And the frequency obviously is different. You need different frequencies for different depths. So the higher the frequency is, the more shallow you are. You understand the difference now? So I think that we've been using incorrectly the word HIFU, and we call everything HIFU, and it's not. This is, strictly speaking, micro-focused ultrasound. This is, as you know, a system that heats up the skin up to 60, 65, and depending on the temperature that you reach, you can have more collagen, you can have more tightening, you can have more retraction. But this system is digital, and the system that gives you the ultrasound is called the digital power engine, because it's not like the other HIFUs or MFUs. It's absolutely different. What digital means is that we eliminate, we take away the harmonics. And the company has this light that is quite difficult to understand because there are so many lines and so many curves and so many sounds that, to be honest, I don't understand. So let me focus now in trying to explain to you what harmonics are. So imagine that we have different singers. On the left side, you know who that man is? He's Nat King Cole, all right? He belongs to my times. I'm not a modern person, as you can say. And on the right, you have the Beatles. So there is a way that we distinguish the sound or the voice of the Beatles in comparison to Nat King Cole, don't you? I know you're asleep, but come on. I mean, you know the difference between the Beatles and Nat King Cole, don't you? Yeah. So why do we distinguish between someone and some other person? Why do we know that it's person A speaking or person B? Well, it is thanks to the harmonics. So imagine that they are these are two skulls, right? On the left side, you have the skull of an African American, right? And on the right side, you have the skull of a Caucasian white. What is the main difference between black people and white people? It's the size of the nose, all right? You see this. So imagine that we are producing a sound. The sound starts, where does it start? Where does it start? Where does it start? Here. Sorry, where? Where? in the chordal strings, okay? So imagine that we are emitting a sound that is the low A, which is 200 hertz, right? It's really 220, but anyway. So when this sound is projected upwards, there are other structures that start vibrating. So we're not really listening only to the chords vibrating. We're listening to more things vibrating. You follow me? And basically, the structures that vibrate are the skull. So if your nose is quite big, the sounds produced by the nose will be in a low pitch. So you will listen to 400, 600, 800, and the sound will dissipate. But in a person that has a smaller cavity there, you can see that the sounds that we're going to reproduce in the skull are different. So we can hear the 200, but then we can't really hear the 400 and 600. So we hear high pitches. And that is why we say usually, look at me, don't look at there. We say that black people have kind of a velvety voice, don't they? And we like it. I mean, you remember how Michael Jackson sang. He was amazing. Nat King Cole had a special voice. Why is it? It is because the cavities in his skull are big. So the sounds are quite low, and he sounds like that. Whereas white Caucasian people have very high pitches, and that's why we distinguish them. They sound more, we say, metallic, like a trumpet, or like this kind of instruments. Now you understand why we sound different. It has to do with the structures surrounding the chord. So for example, when we have a piano, we distinguish it's a big grand piano because it's the wood that is vibrating, not only the chord. So this is what happens with Liftera. Now, Liftera doesn't produce very many different pitches. It only produces one because it's digitalized. And this is Liftera. It looks like this. So if Liftera is digitalized, and we need to overcome that line in which we are producing coagulation or stimulation, how much time are we producing this stimulation? This, basically. But imagine that we're using the older systems. In the older systems, the pitches go up and down because we don't clean the harmonics. So we have smaller times for stimulating. So what we are really doing with normal HIFUs or MFUs is heating up everything. That is why it's painful. Whereas with Liftera, we are producing digital, pure sounds that heat up just what we want. And this is special about Liftera. It's not only important for the pain, it's also important for safety. Why? Where are the nerves? Well, the nerves are not very deep. You see, the temporal nerve is 9 millimeters deep. The zygomatic is 9 millimeters deep. So we can hurt, we can harm the nerves. And this is the main concern with ultrasound technology, to harm and to damage nerves. And this has been the headache of many manufacturers since the technology was out there. Instead, Liftera is very safe. So it's about pain and it's about safety. Is Liftera painful? No, it's not. We know that it's amazingly non-painful. On the opposite, other systems are very painful. And if you review the literature, it's always about pain. I mean, there's a new way to reduce the pain of therapy, right? I can't say the names, but this is published out there. And if you continue, it's always about the pain, because other systems are very painful. And we know here, all the people that work with Liftera, this system is not painful at all. There's another very interesting thing, the pen cartridge. So we know that when we work in a line, all the different points are heated very close one to another, right? But with a pen, we can spread that. So if the patient says, doctor, it's painful, we can move it faster. And we can really decide when and how to heat all that. That's unique in Liftera. So Liftera has coined two new terms, the moving technique and the thermal diffusion treatment, which basically means that you can decide how much to heat and where to heat. Isn't that marvelous? It's marvelous because I can give all my shots without the need of anesthesia. Funnily enough, when you see all the papers published by a different company, you always see them combined with calcium hydroxyapatite. And you say, why are they so insistent in trying to tell us that this procedure is safe with fillers? And why these specific fillers? Do you have the answer? Of course you do. Yeah, the company selling the other ultrasound is also selling calcium hydroxyapatite, right? They're interested in telling you can buy all my products in one. So basically the idea here is that it's safe to do ultrasound with fillers inside. All right, so I followed basically the patterns that I've seen out there and also the ones that I was trained with. So when you do these procedures, you can see in several papers that basically you're giving like 4,000 small shots. I assume that the shots are 1 millimeter in diameter. And this is what you obtain. This is a paper of kind of a bichectomy done with ultrasound. So my question to you, do you clearly see the difference of the before and after? Let me explain that the after is the lower line. It's not the top line, okay? Because I can't really see the difference very well. So I'm going to show what we can do in our office, right? So this is one of my most dear patients. He's been with me since before my son was born. So that is 22 years ago. I've known this, this lady, right? So this is the way we would be using the first of the 6 devices or 6 handpieces that we were going to use in this treatment. So the 1.5 millimeter will go in green, the 3 will be in blue, and the 4.5 will be in yellow. All right? So we're going to use the line and I'm going to use the pen. And I systematically do the same treatment so that I know that more or less I will be giving 12,000 shots, like the 12 months of the year. All right? So first of all, I would be going with the line everywhere. So I will be giving 120 shots. Each shot has 17 shots. All right? Because we're working with a line. So we do lines this way, lines, lines, that, and we cover the whole surface. 1.5 is supposed to be the dermis. This would be the 3 millimeters, another 120, 60 per side. That's 1,000 and 1,000. So we already have 4,000. And then we go with a 4.5. And this is a little bit painful. So it's better to separate. Don't be too close, because otherwise the patient will tell you, you're hitting me, doctor. And then we have the pen. So the pen is usually used like this. This is the way I like doing it. We go from down, upwards, downwards, upwards. You can cover the whole surface of the skin. This is the 3.0, this is the 4.5, and this is the immediate result. And this is what you see after 12,000 shots. So you clearly see the result. It is lifting, and patients are worried. Do I have any downtime? No. Do I have any redness? No. Do you have any crust? No. You can do whatever you want in life. It's fantastic. This is another patient. What we see here is not only a lifting, it is the improvement of the bags of the eye. How amazing. She's a nurse, by the way. 12,000 shots. Another patient. You see the reduction of the small, fine wrinkles? Do you? Or is it too early for you to see anything? Oh, are you really awake? No, I'm not very convinced. Anyway, so what happens after some time? This is after 35 minutes. I do the treatments very fast. How much time does it take you, Dr. Macedo? Quanto tempo você demora em fazer tratamento com 12.000 disparos? 30 minutes. Well, he's fast. What car do you drive? Ferrari. Okay. So If you go quickly, right, you can do it in 35 minutes. But you know the reason why you can do it in this time? And Dr. Mazedo says something very interesting. Because you don't need anesthesia. It's very painless. It's amazingly painless. I've tried the, no, I can't say the name because we are in but I've done other systems and they're very, very painful. So this is actually what you see immediately after. Can you see an opening of the eye? A lifting of the eyebrow? Well, this is 3 months later. And this is 6 months later. So I think that we should publish something about how can you lift the eyebrow with this system. I remember in 2004, amazing technology. It was non-ablative radiofrequency. And I thought that this was non-ablative radiofrequency was going to induce some lifting. We all need the lifting on my edge. And I bought the system. My PhD was about this, and we could not see any lifting. It was very difficult. But you can see with this. Let me show to you another patient. This is immediately after, and this is 6 months later. And here you see another patient immediately after. And see how the softening of the skin has been achieved. We can also use this for different indications. It's not just about lifting. It's also about trying to destroy the fat. And this is one example of a model. She's 20 years old. And we've done 4,000 shots approximately. And you can see an immediate tightening. And you can also see the tightening here. So here's a patient. She's 48 years old. You might not believe it, but she's quite old, right? 48 years old. And you can see the immediate effect. So when you're doing the treatment and it's not painful and you think, well, nothing's going to happen the following day, this is probably the only patient where I had an adverse event, which was some edema that lasted for 3 days. So I think that this system is really amazing because it is kind of changing the way I do lifting. I did surgeries first, right? These many lifts. Then I switched into threads. And really, patients don't like threads. I don't know, everybody's scared about everything today. But this system is so painless, so nice, so fast, that I think it will be blockbuster. So thank you very much.
Good morning, bonjour. So today I will speak about the combined treatment. Before Dr. Inigo was speaking about the companies do it, but patients also like to combine different things. So now I will speak about the treatment that I introduced to my patient, and they have like a guideline to do a treatment for the next 6 months. So, first of all, I would like to introduce a concept that I think is super important, that is natural. Natural is the favorite word of our patients and also the favorite word of all doctors. I listened this concept first time in Brazil when I was in Sao Paulo, and they call naturalização. And I think it's super important, this concept, because this is the combination of 4 different things that are super important for all of us. One is recovery for people that they start before the treatments. Also, the maintenance, that for people that they start the treatment before. And 2 different things that I really like, that is the structures, see the anatomy of every patient, and also one concept that I really like, that I speak to my patient many times, that is the golden age. Golden age means like the perfect age of the beauty, that is around 30, 35. So all people, they like to be of 35 or 30. So we have to do 2 different things. Or well, if the patient starts to do treatment with 50, will be difficult. So we have to recovery of patients that they start around 30 years old. We can maintain this thing making different treatments. So here I think this is quite interesting, the difference between prevention and rejuvenation. Prevention for me is the most important thing, that is just maintain what you have, and rejuvenation is the combination of these two things, prevention and also recovery different structures. Why Liftera is a really good treatment for this? Because with Liftera we can get three different things that they are super interesting. First, neocollagenesis. You can create new collagen because of these 65 degrees that we can create with this hot new collagen. We also will modify our existing collagen. And one thing that people, they really like, than we saw before in the before and after cases of Dr. De Felipe, that is the tightening effect, the lifting effect, that patient can see in this day that they do this procedure. So now I will speak about the synergy. This word I think is super nice for all of our patients, because when you see this synergy, they think, oh my God, this is super new, this is super technological, and they really like to combine different things. So when I explain them how to combine things, I always have two different parts. One is for collagen, and the other one is for the tissue retraction. For collagen, I always tell to my patient that they can combine with many things. Sculptra, for example, that is polylactic acid, and radies that Dr. De Felipe was speaking about, that is the hydroxyapatita galtica. Exosomes, also for the skin, that is super good. Profilo, that is like a hyaluronic acid, but no reticulation, and normal hyaluronic acid. And for the tissue retraction, I tell them that they can combine with different things, like Botox, for example, radies, Profilo, Sculptra, or also for hyaluronic acid, that they can create this lifting effect. But if you tell to your patient that they can do everything, they don't know what to do. And patients, they like to have a guideline. And so this is the reason why I create the protocol, first for Liftera and later how to combine with different things. Because the first thing that I always recommend to my patient that they can start is something that is not painful, that is effective, and they can see a result this day. So when I do this protocol, this is about 12,000 shots, like Dr. De Felipe. I'm not as fast as Dr. De Felipe because I think also patients, they like, when they pay money, they like to be 1 hour with you, at least speaking and more things. I tell them that they can repeat like every 6 months, that they can compare with different things, and I use all of the millimeters, 1.5, 3, and 4.5. First, I do with the line, and later with the pen. That is the special system of Liftera. I combine sometimes because there are many patients. This system is not very painful, but some of them, they say that it's quite hot in the surface of the skin, so sometimes I combine with a system that is called Siberian, that is like a cold machine for analgesia in the surface. And after this, I leave the patient like 15 minutes in a phototherapy. So when I introduce Liftera to my patient, I give this slide that I think is quite interesting because you can combine many different things. I have like 2 different programs. So one for rejuvenation, people that they come for first time to your to your office when they have 50 or 60, and they really like to have like a guideline how to do these treatments. So for me, the first is always Liftera with the protocol that I explained you before, and we start to add different things. First, that I want to add always is Botox, because you know that the effect is around 3-4 months. And later we start with injectables. Injectables, I have like a different shape there of the Botox, because I think with hyaluronic acid we can recover structures. That is what I explained you before. That is the main difference between the rejuvenation program and the recovery and like the maintenance program. But we can combine also with polylactic acid, that patient they really like the combination with Liftera. Also exosome, because when you speak exosome for them is like something new, and they really like to combine, for example, with Dermapen, and that you can do the delivery of exosomes. And also Radies. They can do everything. They can do 2, they can do 3, but some of patients, when they have like this guideline, they do everything because they know that they have to come every month to the consultation to do something that is written in the paper, and they come to do it. And when we finish this, I always tell when my patient do the first Liftera, then they have to repeat the treatment again after 6 months. So this is the rejuvenation program that I propose to them. And later, there is one very similar for people that is just for prevention. Everything is quite similar to the previous one, but the main difference is in the hyaluronic acid. Some people, when they are very young and they start to fill the face with hyaluronic acid, you can see, for example, in this Congress, you see people that the face is completely different. And there is one thing that was super fun that Dr. De Felipe told to me, that in Spanish is, here we have more hyaluronic acid than ingenio, how to do it?
That brain. Yeah.
That brain, more hyaluronic acid than brain. So this is, I think, one problem for young people, that they start to use a lot of fillers, also for people that they are older, but they use too much filler. So for young people, I like to use hyaluronic acid because they like it. But there are other options of no-reticulation hyaluronic acid, like, for example, Profilo. Profilo is also super good to combine in the neck. And I have many patients that they do Liftera only for neck, doing Profilo, Liftera, Profilo, Liftera, Profilo, Liftera. And they see a really good result, because threads is a good option for the neck, but sometimes they are painful for them. They don't like the result. But when you combine these two soft things, when you compare a photo 1 month after, you see a really good difference. So this treatment is the same. We start with the same protocol, Liftera. I always propose Botox. They always say yes to Botox. And Profilo, Sculptra, Exosome, Radies, they decide what to do. Some of them, they do everything. Some of them that they cannot afford everything because it's a quite expensive program. They do at least always 2, because they say, oh, this is the price, but if I only do, this is also good. And they do it. And we finished again with Liftera. Because when you give a program to them, this is true. They know that they have to do everything to have the result that they want to have. So this is the reason why when we create closed programs, they are very safe about what they have to do. And now I will finish with 3 difference before and after, combining these treatments. This one is like 55, 60, I don't remember exactly. But he combined hyaluronic acid, he combined Radies, he combined Sculptra, he combined Exosome, he combined Botox, he combined everything. And now he is so much better, because this is the classic patient that he come with the wife. So he didn't want to do anything, and the wife, no, you have to do everything, you have to do everything. As she forced him to do everything. This is another case that is quite interesting. She's 70, so she's quite old. 70, a patient for our clinic in Madrid. And she's from Ukraine, I think, so she made some things before. So with her, we made all of the program again to recovery structures and to maintain. And she really liked Liftera. Other case, she's a Liftera lover. She recommends me all the time. Liftera is a really good friend and patient from California, but he lives in Barcelona. So he wants to do Liftera all the time, but you have to wait. You have to wait, Stewart. We cannot do Liftera every month. And when you recommend something, he always do. And he really liked to combine things. But he was the same case. He came with a wife, and later now he is a Liftera lover. And the last case I think is super interesting because she always she's the first time, I think 2 years ago was the first treatment that he made. And you can say that the face is completely different because the triangle was like sad, and now after all of this combination of treatments, the face is like up again. So we are speaking about recovery and prevention. Thank you very much.
Wonderful speaking. Both of my colleagues. I was seeing your photo, Carlos, and people are always smiling after Liftera, the immediate effect. I'm going to talk about that. And second thing I was counting my shots to see how many shots I did. So I had a protocol before that it was used 8,000 shots, and people in Brazil told me, "Oh, you're using too much shots. You know, that's too expensive." And it's really not expensive. But then my actual protocol is about, I was making accounts because we mix lines and pen, is about 6,000 shots to try to make a lifting with 6,000 shots. But I think I have to, reconsider. Maybe I'll go to 8,000 shots again. So we're talking about Liftera, and the first thing I have to say is that I don't believe in HIFO before Liftera. I had equipment, it was too painful, it was so hard to do it, to use it. The results weren't so good. So when I got to know Liftera, I began to believe in HIFO technology because I study lasers I've been studying lasers for 25 years. So I was, a little bit upset about HIFO. So I think Inigo and Carlos told a lot of, I'm going to speak here, but let's say why I'm focusing on anatomy because I use it a lot in my protocol. Why is anatomy important? How to avoid problems. Inigo already said that. How to get better results. My signature protocol, I will show you a video of how I do it, the treatment. This is a special patient because she's very nice already, so we won't see a great effect, but it's nice. And how Liftera is making this mindset changing, and that's very important because every time we perform a Liftera treatment, we see patients thinking different when they see themselves immediately after a 30-minute treatment, and that's really great. So I will not say about this. It was so great to hear Inigo talking about the digital power unit, the safety, and individualized results that we can get, effectiveness with safety, and very little discomfort. That's really true. It's fun to treat. Liftera is fun to treat. The doctors have fun using it, especially because it's so light. So the pen is so incredible. And we always, in my opinion, I look always when I treat a patient to see an immediate lifting effect. And Inigo has showed, Carlos has showed that it gets better after. But you have to show something in the first moment so that the patient will have a great satisfaction. And like Carlos said, it's possible to associate with everything. So this is the thermal diffusion treatment. I use it a lot because I don't want to do an even treatment. I want to do an equal treatment. I want to do anchorage in some areas, and I will tell you where. And also, the thermal diffusion treatment is very nice when you want to get the face thinner, shrink the fat, destroy fat, and even the body. So we're targeting, anatomy is important because we're not targeting just dermis. We want to get to the fascia, the ligaments, and the subcutaneous fat. We have to be protecting ourselves and the patient from side effects, and we can use anatomy also to reduce volume and promote the lifting effect. So Inigo already told this. On the right, you see on your right, you see the sensitive nerves. They are everywhere. But if the patient is not feeling a shock, a painful, we're not getting there. So we can go over the nerves if the patient is not feeling anything. No problem. And on the left, we see the motor nerves. And we have two of them, the temporal superficial here, and the marginal mandibular here. And we see here in this slide. But again, I respect a lot this area, but I go all the time over the temporal superficial nerve, especially with the pen. And if the patient is not feeling anything, we're not hurting. We're not getting there. So I use that anchorage area right here a lot with the 3.0 and even with the 4.5 in the lateral part of the head and the anchorage of the hair. So the target is the dermis, and anatomy is important because using anatomy, we can choose the depth of the treatment. And here we see that 1.5 and 2.0 millimeter, we're in the dermis, and we can make a tightening effect, stimulating the retinacular cutis that is there. But when we get deeper, we're getting this mass, the retaining ligaments, and even the fat. So I use a lot this. You know, we have the true ligaments, we have the zygomatic and the mesenteric ligaments here. But I also use the lateral adhesion, lateral orbital thickening, and the superior and inferior temporal septum. These are structures that we can get shrinked and help to give the lifting effect. So here's a cadaver. You see the eye, and you see the zygomatic and the mesenteric ligament here. And here we see the orbicularis retaining ligament. And this is very important also when we want to treat malar mound or festoon. It's my first choice to treat these things. So in this schematic figure, we see all the ligaments lying here, the false ligaments, but also this area, we have the auriculoplatysmal fascia. It's very deep, and I use it a lot to get the lifting effect. Why? So here's the line of ligaments. We will do a different approach. I do a different approach in the lateral part of the ligament and in the medial part of the ligaments. Why is that? Because this work shows so well that the fibrocepta in this lateral part, they are horizontally located in relation to the skin surface. And in the medial part, they are perpendicularly located. So here we do lifting effect, and here we do especially compactation of the face. And that's nice also. People like it. So this is my signature protocol. And like I said, I have changed a bit maybe I'll have to reconsider to give my shots again. But with this protocol, I expect to have a lifting effect in every single patient. So I do 30 shots in line, especially on the lateral part, and then I got the pen. This is the 4.5 millimeter, and I do 1,200 shots in each side, especially on the lateral part, going all the way up here if the patient doesn't feel any discomfort, especially on the region close to the hair. Then I get the lines for the 3.0, and this for me is the universal tip. Everybody should have the 3.0, because either we are in the dermis or we are already with people with thin skin in the fascia or the ligaments. So as people get thin skin, as they get older, if they don't have fat in the face, the 3.0 millimeter is also targeting fascia and sometimes ligaments. And then after the lines, I do with the pen, especially on the upper third of the face, and then very close to the eyes, entering the inferior and superior palpebra, the pen with the 1.5 millimeter, 1,200 shots per side. So this is one side treated. And this is if the patient has thin skin, older, doesn't have fat. I sometimes don't use the 4.5 millimeter, and I take out shots from the 4.5 and I add shots to the 3.0 with the lines, with the pen, and also 1.5 millimeter lines here, especially to get not just nail collagen, but to get better those fine lines that older people have on the cheeks. And then the pen very close to the eye. You'll see that in the video. And also this work shows that the influence of age, and especially body mass index in the superficial fascia. So we see that in this lateral part is deeper, in the premasseteric region is less deep, and in the neck is less deep. So that's why we change, and we change tips. So we'll see the video now. This is a 45-year-old woman. She has, she still maintains elasticity, but she has some laxity already. She has done some procedures in the past, so she has a nice skin, no fat in the area. So in these patients, I usually use the 4.5 millimeter depth just in the lateral part of the face. So here the line of ligaments. Like I told you, I will try to open her eye. In this medial part, I will do compactation of the skin, and in the lateral part, I will do a lifting effect. If she had fat, I'll probably do a thermal diffusion treatment there with the 4.5 millimeter pen. I'll keep on going on this area. So I use most the 3.0 millimeter tip. You see that I will go in the anchorage area, lateral anchorage area with 4.5. But if she had a thicker skin, I will do more shots with 4.5. So these are usually what we get when we have this treatment. We get the dermis, but we also get the fat and the fascia with deeper treatments. 1.0 joule, the pen, 4.5 millimeter. Speed in the maximum, 10 hertz. I always use the speed in the maximum. And I do this movement on the lateral part, and my hand is moving not so fast. If she doesn't feel any discomfort, I can lower the movement. If she feels some discomfort in any place, I will even dribble that little area with the pen, or I will just fasten my movement. And that will give comfort to the patient. She's not feeling anything, even with the 4.5. And I agree with Inigo. The 4.5 lines, they hurt a little bit, but the pen, no. You can use it very softly, very little discomfort. So I'm doing here 800 shots in this area. Now I'll go with the 3.0 lines. I always use the energy in the maximum, 0.7, because it's so safe and it's so, it doesn't hurt, almost doesn't hurt anything. Patients are very, very tranquil. So here I'm doing the lifting effect over the whole face, and you see that I put pressure on the cartridge, and I tension the skin with the Liftera to help doing this lifting effect. And I even go over the zygomatic and the superficial temporal area if the patient doesn't feel anything. Sometimes they feel, and I will dribble that area, and I will use it with the pen. The pen, like we saw, the movements can go fast and we can go slowly. Usually can go slowly to get some thermal diffusion treatment also, accumulation of heat, not just the coagulation points. And I always use it in the upper third of the face and in the temporal area to get the eye-opening effect. But also for her, I will also put some pressure on the skin and use the line of ligaments to make, because she has so thin skin that we'll probably get there. So this is the movement that I make. I never stop. I'm always doing the treatment. I don't stop ever. I just tell the patient, if you feel any pain, tell me where is it in the right time so I can dribble that area. But it doesn't hurt really with the 3.0 millimeter pen. This is a new pen. It's very interesting to be used around the eye and also on the temporal area, because with 2.0 millimeter, we're probably getting also the superficial fascia in the temporal area, and it helps a lot also to do the eye-opening effect. So in this patient, I did 5,000 shots, and we'll see a nice effect, but she didn't want to have any, of course, we don't want any fat reduction in her. We don't want reducing fat pads. So how can we not reduce fat pads? We use the right tips. We don't get too deep in these patients, and we do not do the thermal diffusion effect in the fat pads if you don't want to get them out. And here's the 1.5 millimeter, and I usually go around the eyes, over the palpebra, over the bone. That's very, very important. We have to be over the bone to be safe. So we go all around the palpebra, and we're having also a tightening because the skin is so thin there, and we're achieving the retinacular cutis, and we see that we have, after the treatment, less skin. The skin is already tightened, so we see less skin overlying the palpebra. If the patient has that, we can see that she has a lifting effect, she has an opening of the eye, and she has less skin here in this side than in this side. And this is a 25-minute treatment. So when the patient sees that, it's a mindset changing. And we can do that in everybody. It's not just because she's young. I will show you other pictures. So what we want is the lifting effect and the eye-opening effect in everybody. Please don't photograph the patient's image. So here we have a much older patient, and we see the right side treated, and we see the elevation of the eyebrow, and we see the malar support different and less weight here than here. And that's for everybody. See another patient. This is the left side treated. I always treat the left side for my, so I know that every single patient has the left side treated. This is the only one that I treat the right side. It's the same effect you see in everybody. So compactation of the dermis, malar sustentation, eye opening, less volume here than here. Always the left side treated here. Look at this patient, very heavy skin. So we have also some thermal diffusion treatment here in this area. Older patient, heavy skin, light skin. Here we use a lot the 4.5, and here I don't use the 4.5 millimeter. Always sustentation of the face, less volume in this side, malar support. And this is the effect after both sides treated. She's got a little better. She doesn't know why. Everybody's going to look at her and say, you look nice. But they don't tell what's going on. And we have a lot of treatments, a lot of patients. We do some support. This is 5 months after the treatment. Better contour, better malar support, eyes opening, better contour. We treated the neck here, also the submental. Here, using the 4.5 millimeter thermal diffusion treatment to get this area shrinked 2 months after one treatment. Also, the contour, the submental area. And that's for everybody. And see, again, patients, look at the volume of the skin here, tighten, opening of the eye, a little, the face a little bit shrinked. They like it. People who have this round face, they usually like it. Some don't. I treated a Korean guy. He said he would like to look like Buddha, so he wouldn't like to get the face shrinked. So here, another nice effect, and also removing this fat around the eye, just with Liftera pen, and also application of face nade. One session. And another Oriental, and they like it very much when we get this shrinkage effect here, compactation and lipolysis. And this is the normal patient, you know. She will look better after 30-minute treatment. And we can say exactly what happened, you know. What's that? Another one, contour. And that's what I wanted to say. People are always smiling when we take the picture after Liftera. And that's mindset changing. People look to themselves and say, something different? And that's something we have to tell them. And I do, because there is a psychiatrist, William James from Harvard, that's been saying that for a long time, how the body can influence the mind and the feelings. And there's a nice work on Botox showing that it can improve depression because it changes the way people look to themselves. So we do that all the time. We are changing mindset, and patients are always smiling after the treatment. It is immediate effect. She's smiling. I'm not telling them to smile. It's something natural. Look at that. 30-minute treatment, and we are always having this effect. Something is changing, eyes are getting opened, malar support, less weight in the lower third of the face, and a smile. So this is my assistant there in São Paulo. She wanted to get a little shrinkage, a little fat removal from the lower third of the face, but she got a lot of eye opening. And this is the immediate effect. She's smiling. We got this area thinner. Did myself. Well, you're giving the lecture, of course you're going to smile, but it's natural. And we have some dramatic results. She didn't have Botox here. She's just mindset change, you know. And this guy is very interesting. He's the one that didn't want to look like Buddha. He wants to look like Buddha. But he had apoptosis after Botox, and I could get that better just with Liftera. So we treated the right side where he had the apoptosis, and then we treated the left side also, so we could get his heavy skin a little bit better. And the midterm effect is that we have skin quality, like my colleagues have shown. So not just sustentation, but skin quality. This is my assistant. 80 days after, she's getting even better. Eyes opening, lifting effect, immediate, and 80 days. And we're changing really, sometimes we're even changing lives. You know, this is, she works with me, and she got this result with Ampere and Liftera, just one treatment. And then we did another treatment and another Ampere application, and she went to the gym, she got thinner, and she even got blue eyes now. So why Liftera became the top treatment in my clinic? It's almost painless, it's fast. We can have this wow effect, every single patient, mindset changing, empowerment, patient satisfaction. It's part of a protocol, like Carlos told me, what I call the Y pill, or the youth pill, where we mix things to get people young forever. And that's myself. I didn't do anything before, and then I started treating myself 4 years ago now, and I got better. I didn't get older. And that's just technology. And one single filler 3 years ago. So that's what we're doing. So nothing is more powerful than an idea whose time has come. Victor Hugo said that. And the idea is that we can now maybe have people, their skin at least, young forever. Thank you.
Hello, thank you very much for this presentation. I'm André Borba from Brazil. I also work in Portugal, and so we are very happy with our treatment, with Liftera treatment we are doing there. So I'm going to show to you a little bit of myself. I studied at UCLA, and I am an oculoplastic surgeon. So I do a lot of blepharoplasties and also eyelid surgeries, okay? I always like to understand a little bit more how I can take this patient forever in my clinic, because in general, they came for the surgery and then they go away, go to the dermatologist, and I'd like to keep or delay another surgery with some treatment. So it was something that I always thought in my life. And we know the look affects significantly, individually, also sexually and emotional expressiveness. I always think, what story do you want your patient will tell about you, okay? And we know that what we are doing here, we know that all of these words is exactly what they feel after a treatment like Liftera. And I'm so happy with this, and that's why I'd like to share with you guys. The blepharoplasty, it's my art. I do every day, so I'm so happy with my results, but I needed to keep this skin better and better. So blepharoplasty or any other plastic surgery does not compete with the Liftera. This is the thing, okay? We needed to understand that we have the Liftera. It's a nice treatment forever in our clinic. This is smiling, Dr. Macedo told, that's truth, okay? And this is why I'd like to come here and to say, look, I can do blepharoplasty, yes, and I can do also Liftera, because I can help the skin, okay, to be tight and to make a lift. So for me, it's perfect for my patients. So the other thing is the eyebrow lift. This is another surgery I do a lot, but there are some patients doesn't want to take it or to have this done. So I combine a lot of treatments, and I always say about, I tell them about Liftera. What I'm going to say to you guys, blepharoplasty does not improve the periocular skin quality, number one. Number two, it does not bring new collagen by itself. So I just cut and remove the skin, and I make something tight, but doesn't make it better. I always have to use another kind of product, or chemical peel, or laser, CO2 laser, or something like this. And I still need to treat my patient on a regular basis. So this is the point. Our cosmetic patients, we know that for the eyes, especially for the eyes, we need to listen a lot our patient complain. And also make a plan that is very effective for the eyes. They are always very scared, and they are afraid of any problem, to have ectropion or to have another problem in the eyes after a surgery. So some patients we need to treat before a blepharoplasty. They come to my office and they say, don't you have a blepharoplasty that is not, there is no cut, something that I can have a little bit better, but it's not cut? And we needed to think about something that it's safe, avoiding complications. So how to indicate effective and safe complementary treatments? And now I do the same of Dr. Carlos. So I combine treatments. It's impossible to treat an eyelid with one treatment. It's impossible. So it's really impossible because we have so many things. I'm going to show to you the clinical indications. But Liftera has a fast recovery, no hematoma, or if you're going to do something, you can have some. I never had any hematoma. It's effective and results safe, and downtime like nothing. So this is a thermal diffusion. Everyone showed this slide because it's fantastic. This is exactly what we need to our treatment on the eyelid. And I'd like to show to you this. This is, for me, this is the best. I have a course, an anatomy course in Brazil. It's called pálpebras. It's like eyelid, only about eyelids, and it's in Portugal too. And the most important thing in this course is that we show all the techniques. And last year, I showed Liftera for the first time. And look at this. This is the cautery we use in the surgery to remove the skin and also to make some cauterization. Okay? But look at this video and this video with Liftera that I used it for the first time in May of last year. And look, the first video, we can see the line scan treatment. Okay? Are you seeing how it hits? And the other one is the pen with 1.5 millimeter. Look at this effect. This is wonderful. This is fantastic. So I am so happy with this because when I saw that, I knew exactly what's going on my patient during the treatment. So as a surgeon, I'm not so, you know, it's wonderful. So what are the clinical indications? Excess of skin, because you can tighten it, you can make it better. Skin laxity, you can use it, and for laxity, it's nice. Fat bags, yes, you can go there and make it decrease the amount of fat bag. position and contour of eyelids and eyebrows, skin quality, and also you can reduce the volume in any place you want. So this is in my office. We are doing here in this part between eyebrow and the eyeball. So we need to make sure we are in a good layer because we cannot have problems with the eyes, okay? You have to prevent all problems, so you have to remember this. Don't go there and coagulate the eye. So this is the most important thing, right? And the main effects in the eyelids, we know that the neocollagenesis, it really remodulates and the existing collagen, and we see the retraction. We see the retraction. That's it. This pen is fantastic. I'd like you guys to know it and to use. So this is in the lower eyelid also. This is the movement we do for treating. The moving technique is wonderful because we can reach nice results with this technique. If there is pain, as everybody told, you can go fast, okay? We also can see and respect the patient's anatomy with this pen. So the pen for the eyelid is fantastic, okay? That's why I bought this machine 1.5 years ago. For me, it's perfect. So I think we need to recognize all surgical cases. Okay, I'm not going to use in everyone only because, of course, this case I first operate and then I do my Liftera. But look at this. We need to understand that the periocular treatment, we need to see and check asymmetries, functional disorders, high expectation of the patient, and also costs. That's why what Dr. Carlos showed to us is perfect, because every 30 days, the patient go to the office, and you can present some good treatment for him, and it's going to add the rejuvenation plan. It's going to be much better for him. I have a lot of protocols that I did in my clinic, but we needed to think with the right side of our brain because we need to be creative, okay? And this is what I designed for my office. So the periocular treatment's there, and the Liftera is the first one. The first treatment I do now, the patient come and I always say, look, we need to do, I know you wanted to operate, but we can treat your skin. I can prepare your skin and we can do it before or after. What do you want? What do you prefer? Okay? So every patient loves it because there is no cut. There is no crust, all right? So, and he can see the difference between the start of treatment and after the treatment. Then I can wait, they wait like 2 months for my surgery, and these 2 months they are treating. They are doing something for the surgery. The combination of treatments, that does the difference when we talk about eyelids. So I can, after use injection and toxin, I use pills and also laser. I always do 1 or 2 treatments together with the Liftera. Of course, the balance is important, right? Because we need to think about costs, we need to think about and many other factors, and we need to understand. Here, we know the diagnostic aspect. I say to you, the periocular area is so important to make a diagnosis as well. You have to look at your patient, you have to photograph or make video, and also touch the skin and see how flexed it is, how tension there is. So the diagnostic is important. In this case, let's come back. In this case, we can see muscle, right? So a toxin will be nice, but there is a lot of also laxity of the skin, and we can make it better. We can make the eyebrow exactly at this part of the tail much better than it is. So the treatment starts here with a mirror in front of the patient and you explaining what you're going to do. And this, at this time, I say to the patient, look, Liftera will help you with this and that, right? Before the surgery or before the filler or before what else? Again, it doesn't compete with any other treatment, right? And then I say that Liftera pen helps, as I told you, helps avoid every problem we could have with the other treatments that we see. And I underwent for those treatments before, and I am so, the pain is terrible, and also the problem there is it's so close to the eye, and so with a pen you can avoid everything. So now I'm going to show my signature protocol. So I do in my office like this. So I love to make the hashtag in this part of the temple. I think it works a lot, okay? And my protocol description, I did like this, 1.5 millimeters to make it tight with 50 shots. And then the moving technique and the lower eyelid, it's fantastic. I love it. And then I'm going to show to you. We can make it better. We can go more than the eyelid, the lower eyelid. We can do a little bit more, and also hashtags. The most important thing is to avoid the nerves. So we need to understand that we have the infraorbitary nerve there, the medial part, and also the supratrochlear and supraorbital, that they are very close to these areas we are treating. Okay, so I'm going to show some combined results, because as I told you, I combine everything with Liftera. So this is a patient I did Liftera and also CO2 laser, right? So we can treat and help these patients with this.
Fractional or co-imaging?
Fractional, yes, fractional, right? And the benefits we all know. We have the immediate elevation of the eyebrow. So this is, for me, this is the best. This is another patient I love to show to you. What I did was, I did the Liftera, and then I did a session 30 days after, a session of filler, and also we can see the eyebrow and how it works. Look, it was almost impossible to put a lot of filler in the lower eyelid without Liftera before. So I needed to do Liftera first to make it tight, to make the tissues better, and then I fill it, right, to make it better. We also need to understand that this type of skin, very thin skin, it's very complaint of many patients. We have to treat with Liftera, and we also can have another treatment as threads, for example. I love it because it's a nice treatment for these cases. Of course, it's not in 1 day or 2 days that's going to be better, but it's like 3 months, but the patient's okay after. So the other treatment is for the tail. I like this kind of procedure. We are doing many, many times, okay? And I do like 200, 300 shots. Don't forget we have the roof and the SUF, and they are structured, very important in structures, the fat that's under the orbiculary muscle. So we have the roof part, and the upper eyelid, and then the SUF, suborbital oculi fat, and then we can also manage this fat and make it tight or melt a little bit of it. So the treatments I love to do with this treatments are like these ones, and also I love threads, as you guys can see. So the toxin, I always write some papers and everything about it. Safe. So safe for me is the point. And this is a paper that I did. You see, this is the result we'd like to have with toxin and also Liftera. And the fillers, Liftera, and also this kind of treatment in the tear trough and malar area. And this kind of skin, you can see the quality is so thin. We need to be pay attention and to do Liftera for make it thicker. Okay. And the problem in the oculoplastic surgery is always that we never know if we add or if we remove a fat. And 20 years ago, everybody removed fat of everything. But nowadays, we have a movement to keep the fat. So the Liftera came exactly in this moment. It's fantastic for us because we cannot take it out, but we can remove only the volume, make it shorter, tighter, and decrease a little bit the volume. So this is another case. I did Liftera, and also I did the filler, Liftera and filler, and the eyebrow surgery, Liftera, and also blepharoplasty, and also a little bit of filler. And the biostimulators, of course, we need to use them for those cases that we have a lot of laxity. So we know that it's going to help us a lot. So we need to use it in the contours. I love to use it. We needed to use, and then we have good results in some patients, like you can see. And this one, okay? So this is Liftera and also biostimulators, injectable biostimulators like Radies. And the laser as well, we can help these patients. It's so flexity, 30 years old, with a lot of flexity. So I did first the Liftera, and then the surgery, and now he's very happy. So it helps me also with the amount of skin I'm going to remove from the lower eyelid. So we in general, we don't remove a lot of skin, all right? And the threads, I cannot forget it. They are fantastic. I did a paper about it, and I love it on the eyelids because it's the best, I think, one of the best biostimulators we have, because we cannot inject biostimulators on in the eyelids. So the thread it's nice, okay? It's a nice treatment. Like this, okay? And also the thread that we do a little bit of lifting in the lateral part, the tail lift. Chemical pills you can also use if there is some indication for this, and I like to use it after our treatments. So the best treatment for us, just to finish, is that patient we can do all we want and she needs, all right? So like this girl, 35 years old, a lot of laxity, she was so sad with this aging process that it was really terrible for her. So look at this, and after Liftera, after Botox injection, and after fillers, she's like this, and so happy with the skin, the quality of the skin. So this is the most important thing. Everybody is happy with this treatment, okay? And for us, it's I'm so happy I've been here because it's all I presenting is truth. It's my day. I do every day. So this is a course I have in Portugal if you want to go. It's a course we do every September, and with cadavers, fresh cadavers. If you want to go, I will be happy of having you there. This year it will be in Coimbra with only about eyelids, right? Whatever you guys need, I'm so happy of having you there. We cannot forget this, right? And this is my Instagram if you need something. Thanks.